what is the safest anabolic androgenic steroid? And is there one? Is there actually a safe anabolic steroid? Well, people have asked me this for many, many years, and my initial response is very straightforward, that we have no trials on this. We have no prospective, randomized, double-blinded, we have no great, really, outcome trials to really show us if there's a safe steroid or not. So it has to come down to anecdotal information, which I have much, actually, on thousands of patients that have used steroids and have come to me and trusted me as a physician for many years. Anabolic steroid safety is a very relative term, because indeed people have used steroids for decades actually, and some of these people actually appear to kind of live long and normal lifespans and quality of life. But let's get right into it, guys. Let's talk about this. So this is very important actually, so stay with me on this. And let's get a lot of comments, because apart from my discussion here, it's going to be the comments and the openness from all of you for other men to understand and to learn. And of course, this is something that's so great on this channel. Thank you. So it's a spectrum of safety. It's based on you, your history. Who are you? What's your medical profile? What's your family history? This is stuff I do every day, guys. So are you young? Are you middle-aged or older? Even middle-aged and old guys start steroids, and it's obviously potentially going to be more damaging and less safe for them because they're older and they may have plaque in the artery. Do you have plaque? Well, you need vigorous monitoring. You need vigorous health screening, and that's why I love to help you guys. So let's look at safe steroids as a spectrum of safety. So there's minimal effects to full-blown effects. And if you look at the minimal effects, you have to look at someone uses a steroid, whichever one we're going to discuss here through the end, of what steroids there are, and the compounds and the profiles and dose and duration. And what happens is, do you have full recovery? Do you do the 6-week cycle of anavar or testosterone, and do you recover? And is your recovery in full? Do you have any medical consequences during it? Or, as we consider and discuss, in the post period, does post-psychotherapy work for you? Does it work for anyone actually? Hey guys, quick pause. As you noticed over the last month or so, I've been doing a lot of traveling. I want to mention a tool you may want to use if you're a traveler like me. Surfshark VPN. Surfshark is jam-packed with features that benefit travelers. It allows its users to overcome location-based price discrimination on things like car rentals by connecting to VPN servers in other countries. Surfshark will also help you not get frozen out of your own bank account when you're traveling far from home. Lastly, and this is my favorite, Surfshark will allow you to safely connect to public Wi-Fi by encrypting your data. I relied on public Wi-Fi when I was on the road last month the whole time. Surfshark will allow you to stay safe on the road. Does post-psychotherapy work for you? Does it work for anyone actually? There's no data on this stuff, guys. It's all anecdotal. So we have to see it as a spectrum of safety. So you have to think, and guys, I do this for you to think. Is it safe? What is safe? But we're going to go into the different drugs. We're going to do it because it's ethical and it's educational for you. And I want you to think. It's all about stimulating your own thought and questioning yourself. Is it worth it? Do you want to do it? I know you did your research, but does the research end up being something that leads you to a place where you are happy you did it and it worked, or are you regretful? And do you suffer? And are you hurt? And what do you do about it? So you have to look at it from the first piece is, do you recover? Is it safe from a perspective, do you recover? Do you take a steroid with or without PCT, and does your hypothalamus pituitary gonadal axis recover? And do you end up needing to be on testosterone, guys, with or without HCG and Clomid and all these other kind of drugs for years, months and years? Can you go on and off? The fact is, men can. But you cross this line. You cross this line. Keep coming at me. Do another cycle. I don't care what you do. I don't, obviously, minimal drugs. If you do a baby dose of anavar for 1 week or 2 weeks, and you come off, you don't have an effect because you didn't get an effect. So the mountain you climb in the fall is going to be proportional to the energy of the fall and the climb, the potential and the kinetics, guys. You got to think of it that way. Dose dependent, durability, sustainability. You got to think of these. Is it sustainable? What's going to happen? Guys, think. So number one safety measure is anabolic steroid induced hypogonadism. It's my claim to fame, what I work on with you guys. You do steroids, I don't care if it's 1, 2, 10 years, somewhere along the line, you get shut down. And that's where I come into play. And that's my number one safety feature. So, and then it becomes harm reduction, guys. Then it becomes harm reduction. Obviously, the first piece is going to be, are you shut down or not? And do you recover? Do you recover in 1 month, 2 months, 6 months? Do you need the full year to recover? Do you regret it? Do you come back? Is your sex drive exactly great as it was before you did it? And then after that, guys, I have to prioritize it. After this, it will be, is it safe for hair? Is it gynecomastia and acne? That's cosmetic stuff. Then, is it safe for your heart? Is it safe for your mental health, your prostate health, your organ health, your kidney health? Guys, please, and it's inherent to your history, the duration, the amount of steroid, what steroids. Again, it's all going to be a little bit has a little bit of a response and an aftermath. A lot bit has a lot bit of a response and aftermath. Guys, look at the comments. Give me the comments. Let's hear it. There's a spectrum of people. People in life and physics and medicine is always a spectrum. No disease, mild disease, moderate disease, severe disease. Along that way, are you getting hurt? That's why the monitoring and the vigorous vigilance and the safety is just what I'm driving home. So let's go into it. What is the safest steroid? By any means, and any anecdotal information, there's no studies, is going to be testosterone. It's a steroid and it's commonly used for testosterone replacement. It is going to be a spectrum itself. Baby doses, micro doses, TRT doses. What's TRT versus a steroid? For all you new guys, very interesting. This guy's, he's just on testosterone. He's on TRT. I don't know, but he takes 400 a week or 200 a week. And then you look at the free testosterone or the total, and depending when he went to the lab, depending on what he's on, it's a huge number. Then it's a steroid. But then if he waits a few more days, he goes to the lab and it's TRT, or he's even lower. Now he started testosterone. Very commonly, he goes to the lab 2 weeks later and he's lower than his baseline. What's going on, guys? Come on. So testosterone has to be looked at from a delivery system perspective. There's going to be a pill, testosterone undecanate. That's rarely used, but it is available. Has to be taken twice a day with meals. It doesn't work as great as some of the other mechanisms, which is intermuscular delivery system, but it's available. There's gels and creams, there's a patch, and there's a pellet. Okay. Now, if you look at testosterone, it's well documented for decades with a decent and safe safety profile if closely monitored. It does produce wellness for men that, again, need it, and they're well monitored and are on the appropriate dose. And it is, most importantly, sustainable for life. Now, let's go into testosterone intermuscular esters. Okay, propionate, cypionate, and naphthate, sustanon 250, those are the big ones. There's combinations of different things. So It's the small doses, guys, again. But again, it's going to shut you down. You have to understand that you're going to be shut down. Are you 18, 19 years old? Is that right to tell you to go on testosterone? That's ridiculous. That's going to shut you down. But somewhere along the line, if you are shut down and you need testosterone, or if you have low testosterone and you're on testosterone esters and you feel great, is it a steroid? And can you have sustained well-being? You can. There's tons of data on this. There's no perfect data on testosterone, randomized, double-blinded, prospective studies, but there's a lot of studies anecdotally, and there's a lot of data that it's common sense, and if you take testosterone and you need it and you keep the dose as low as you can do really well, obviously. So that's the safest steroid, guys, and it's interesting that every bodybuilder, every guy that does steroids, which there are tens and millions now, they end up on a base taking testosterone. Give me the comments, guys. I mean, this is just no question. No one's going to disagree with this. So theoretically, the safest steroid is without doubt testosterone. The doses, something like 0.35. This is testosterone cypionate, for an example, a dose of 200 milligrams per milliliter, 0.35 to 0.5, 3 to 5 days, every 3 to 5, maybe 7 days, every 7 days, and you want to use the lowest effective dose. And it can be outstanding, absolutely outstanding. And it will increase. I mean, your free testosterone, guys, is going to be higher than your testicles could ever make. So it's technically a steroid. So you have to be careful. And again, you're going to be shut down. Now, so that's it. After this, guys, what's next? Other steroids. You have to kind of start off with a kind of a differential diagnosis of exclusion. You have to kind of exclude like what's not potentially safe as far as the steroids and the mechanisms and the delivery regimens, if you will. So what's not safe? There are other regimens that are not sustainable, and they're done in cycles, right? It's dbol, anadrol, winstrol, equipoise, deca, and then tren. So it's not that guys haven't done them and they haven't lived to tell about it, or, hey man, I'm fine. They're all on testosterone, right? So they're all on they're gonna blast and cruise, guys. Blast and cruise. Guys, so many of you guys have been coming to me with consults and on the app. It's awesome. And they don't know what blast and cruise means. And the guys who really know what blast and cruise means, they are aware of what I'm talking about. You do steroids, you cross the line, you're going to need to be cruising on testosterone, TRT, which is, the doses, interesting, are not TRT doses technically that, for an example, a physician will give, because they're just not sustainable, they're too high, but it's common sense. So these drugs that I just talked about, the dianabol, the anadrol, the winstrol, the equipoise, the deca, and the tren, they're done in conjunction usually with steroids and high doses of testosterone and other drugs, of course. We're not talking about clenbuterol and other performance-enhancing drugs and growth hormone, these things. We're talking straight up steroids. So it's not safe, but they can be safe because guys are young and healthy based on your profile, and they don't do much. You look at some of the other good YouTube guys that are amazing, right? They're not doctors, obviously, but they pour their blood and guts out talking about information, and they've done steroids. For an example, Greg Deschette, amazing guy. He's done steroids. He's very, very openly said that at his age, he's just on TRT, but he still looks phenomenal. So he maintains and he's on TRT, and apparently he's healthy on the inside. He's a smart guy, this guy. He's not a doctor, and he doesn't say he's a doctor. So is it sustainable? And is it safe? Obviously, if you do one dbol pill every month, is it going to work? But therefore, is it safe? But doesn't it even worth it? Think, guys, think. These are the regimens. There's no long-term studies on it. But let's get into something. I want to tell you guys, because this is what this video is. What's a safe steroid? I told you it's testosterone. There's no question, but you're going to have to need it, and you're going to be shut down. Let's move on. That's your decision. Next one is, what other regimens have been used for decades, and they've appeared to skirt significant health consequences? something like low doses of anavar, alternative regimens, maybe anavar 10 to 20 milligrams on training days, or guys will use it once a week, twice a week, 3 times a week, even low dose every day, but that's not potentially safe. And again, no one knows what safety is. This is not medical information and recommendations at all. This is simply talking anecdotally what I've seen. Men for decades. I've had some men for almost 20 years under my care. Oh, the grace of God. And they're healthy, they have good genetics, they've taken good care of those, they don't smoke, they don't drink, they use a little bit of steroids. Doc, I've trained. They're all on testosterone, guys. So they're all going to be on testosterone because they cross a line, and the safety protocol and the profile end up shutting them down. So they need to cruise on TRT, hopefully it's real TRT. And they've been monitored, vigorous monitoring with me and other physicians. And they've been lucky, so luck in here too. So, and they've taken throughout the year, I hear it all the time, guys. I'm not recommending it, I'm just telling you what I hear, what I'm passing along, small doses on training days of anavar. But they don't run it every training day. They don't run it every week, every month, and every year. They take breaks. And again, they're vigorously watched because they've been under my care. They came to me because they cared about this. And physicians, this is why we're moving into it, and so many good physicians contact me and refer patients to me. Unfortunately, a lot of them is too late, where they have severe disease already and it's too late. We have to really just harm reduction and secondary and tertiary protection and medical consequences. It's so sad. Now, what's next in addition to like the TRT and the anavar? So many men have done TRT in small doses of masteron. Again, so the anavar, interesting, and the masteron, both DHT-derived drugs. You can see all the videos I've done, the educational videos on this. So, so men add small doses of masteron. I don't know what the doses are, guys. Small doses, in addition to the testosterone. It does a couple of things. It increases the free testosterone profile, and it's pretty consistent. Some people think, although I've checked labs on this, and it's not across the board something that I would support, but it's like an anti-estrogenic effects. And don't hate on estrogen, guys. I think I've proved that. But certainly if you have too much estrogen and you have anxiety and all these things, not to mention gynecomastia, acne and these things, it's going to worsen things. Common sense, guys, common sense. So dose dependent. But it can have effects. Some men love that effect, not recommendations, guys. They love a little tiny added dose of masteron. I've seen it for years with guys, and they'll come off, and it increases the free testosterone. They have a sense of wellness. If they don't have depression and anxiety, have to understand this, guys. Not recommendations, and the profile of the individual patient is paramount. But they'll get the wellness. That the brain affects. I sell more cars. I'm just a nicer person. I just feel more bubbly and confident, and it's sustained. Wow, the sex, unbelievable. Now, is it sustained? Are there trials on this? And is there trials that show prospectively that you can stay on this stuff? And your free testosterone is up on masteron. What's going to happen to the free testosterone with your left ventricle? The red blood cells, your prostate, BPH. Wow. This is incredible. This is why we're here to think, guys. So follow me on this. But I can tell you this. I don't care if it's test low dose with masteron or alternative dose anavar on training days. But these are those are the two safest, quote unquote, as per the anecdotal literature and the anecdotal men and the anecdotes in the history of what's out there in the streets for years versus taking tren with something. I mean, and I'm not saying guys, they haven't done it, but that's just not sustainable and safe. Dianabol, I know guys do it, anadrol, dianabol, equipoise, we know it, but nothing like these other two drugs like anavar and masteron. And again, it's not medical advice, guys. This is an educational video. But in the end, what happens, and is it sustainable on masteron or even anavar? Do they feel poorly? They can. I've seen the sex numb down. It's interesting, these DHT-derived drugs on top of ester of testosterone. Wow, this is great for the bro science guys. So what happens to the central nervous system? Does it numb down? I've seen many men live on too much of this with the testosterone, too much and anavar, and they're impotent. And they did great through period. And then they just came to a point, and I have to hit a reset button. A lot of you guys know, and you guys know I've talked about that. So at what point? And that would obviously lead to the minimal alternative regimens of hitting it and backing off, hitting it and backing off, and being safe. But then is it effectual? Is there an effect? Is it sustained? Is it worth it? It's up to you guys. What's happening to your heart? Blood clots, red blood cells. Have to think about it. Many other regimens are intermittent and low dose, and men have done it. And there's just no question at all. The side effects and the safety profile start from the cumulative effects, guys. The cumulative effect of using these drugs with testosterone, even by themselves. I want you to think cumulative. You know what happens? Your hair, gynecomastia, of course, the cosmetic and the acne, heart, prostate, central nervous system, mood, anxiety, depression, worsening. Baseline, guys, it's baseline, and it's on the steroid now. And sex, because having great sex typically leads to great moods. Having bad sex typically leads to bad moods. You got to understand this, guys. So with these regimens, close monitoring is absolutely, without doubt, going to be the safest means possible for any man in any domain, in any understanding, under any regimen, actually any medical regimen of monitoring. It's what we do for any medicine, blood pressure medicine, cholesterol medicine, any acne medicine, Accutane, you need to be monitored. So that's it, guys. Let's get some comments. Always wanted to do this video. I think I pulled it off ethically, and I think you're going to get something out of it, right? Because I actually gave you some information. So lay it out, guys. Let it out. Let's go. Get the comments going on this. Let's really see from you what's been safe from your perspective, and something maybe that's not been safe, and the acute medical issues, not to mention chronic medical issues. Thank you so much, guys, for the love and the support, and most importantly, I really hope this video helps men, young men, make a decision for, of course, not doing steroids at all and making an alternative plan. And if you're on steroids, to protect yourself from the get-go, and to be as smart as you possibly can, because it's a crapshoot, guys, and life is a crapshoot sometimes. So you have to be healthy as you can. Thank you so much. I really appreciate it.